Well, hello everyone and Happy New Year. Happy 2022. My name is John Roller and I am the head of the Medicare division here at Winston & Company's Retirement and Financial Services, and I'd like to welcome you to our Welcome to Medicare enrollment webinar here for 2022. There are some new numbers, and so we're going to go ahead and get into the numbers today, and we hope that it's very helpful to you. So I'm going to go ahead and squeeze this down, and we can go ahead and get started here. But before we get started, I want to go ahead and give a little disclaimer here for our program. Today's material is going to be of general information. Basically, it's to help you understand basic retirement strategies, and Medicare is a very important part of those strategies. Now, our legal team keeps us on the straight and narrow as far as keeping everything on the up and up. So we're not going to talk about very specific things today. We're going to talk about general information. Now, after seeing this webinar, if you'd like to schedule a time to come in and talk to us, and a lot of people have, we encourage you to do so. It's a no obligation information gathering session here. We are brokers, so we are not beholden to any one Medicare company. We can find you the best plan that fits your budget and lifestyle. So let's go ahead and we're going to get started. And for a lot of you that have come to one of our classes or watched a webinar or called our office, this may look kind of familiar to you. A lot of people have a lot of questions and it looks like a big maze. So today we're going to try to guide you through some of these maze questions that you may have and hopefully give you some valuable information as you prepare to enroll in Medicare. So today we're going to cover facts about Medicare, some of the options that you have for Medicare, some of the costs that you will incur in Medicare, and very important, some dates for you to remember as well. So what is Medicare? Well, we like to say that Medicare is divided into three parts, right? Three parts. Three parts? Yeah, three parts. What we like to do is say that Medicare Part A and Part B constitute one part of Medicare, or in other words, original Medicare. And then there's the Part C, which is also known as Medicare Advantage. And then we have our Part D, prescription drug coverage. So we combine Part A, which is your hospital insurance, Part B, which is your medical insurance, Part C is a standalone plan, which often includes your Part D, your A and B for Medicare, and then your prescription drug plans as well. So who is eligible for Medicare? Well, individuals age 65 or older who are eligible for Social Security retirement benefits. Now, we see an awful lot of clients here that come in as they are getting ready to retire. They may be a little bit younger than 65 years old, and we always make sure that they have contacted Social Security to sign up for their Part A. If you've worked 40 credit hours over your working career, you will be eligible for Part A or your hospital coverage at no cost to you. Okay, it's very important. You'll have 3 months prior to your 65th birthday, you'll have the month of your 65th birthday, and you'll have the 3 months after. So you have a 7-month window to sign up for Social Security retirement benefits. Now, we have a number of clients that work past age 65 and they stay on their health insurance at work. That's just fine. But what I want to remind you, and as we get a little bit more into this webinar, that it is very important that as you get ready to retire, no matter what age you are past your age 65, if you're going to be coming off of your health insurance at work, that you make an appointment with Social Security, and there's a number of different ways to do that, to sign up for Part B. And you want to make sure that you do that because there are penalties involved if you don't sign up for Part B. You'll see the second bullet point there, people of any age who have been entitled to Social Security disability benefits for 24 months, and there's no waiting period if you have ALS or Lou Gehrig's disease, or anyone that has permanent kidney failure. So ways to apply for Medicare, we just talked about it. In our post-COVID era, there are a number of different ways to apply for Medicare, and I'll leave this up on the full screen here for you to take a look at. And the first one that we always recommend is that you go on to ssa.gov and you establish an account. ssa.gov, and it'll ask you some questions that are only pertinent to you that you know about, and that will get you started for your account. The other is the 800 number that you see there, 800-772-1213, or you can sign up in person. You can visit your local Social Security office, and you can call and make an appointment first. Again, we have clients in that are 2 months, 3 months away from retiring, and we always encourage them. It's probably best to go ahead and set up an in-person visit to Social Security, but make sure that you go in and you sign up for your Part B. So let's go ahead and get into it. So Part A and Part B are otherwise known as Original Medicare, and it's offered by the federal government. Now, I want you to notice the words there, helps cover. Original Medicare does not cover all of your costs. It helps cover some of the costs. So if you'll remember, Part A is hospital, and hospital is your stays in the hospital. It also covers parts of skilled nursing facilities, hospice, and home health care. So remember, Part A is your hospital. Part B is your doctor, right? Doctor appointments, outpatient care, occupational and physical therapies. So Part A is your hospital, Part B is your doctor. Now, as we mentioned, Original Medicare does not cover all of your costs. So we have the new numbers in for 2022, and I want you to take a look at them. Part A costs in 2022, if you have worked your 40 credit hours over your working career, you pay nothing for your monthly premium for your Part A. However, don't get your deductible and your premium confused. Your yearly deductible in 2022 for your Part A, your hospital cost, is $1,556. You may want to write these numbers down, because as we get a little deeper into the presentation, you'll start to see these numbers, and maybe it'll help you make a decision. Should you go with a Medicare supplement, or should you go with a Medicare Advantage program? So there you see your Part A deductible, your yearly deductible for your hospital cost, $1,556. Your room copays. Now, up to 60 days, you pay nothing. But you'll notice there, day 61 through 90, the costs have gone up a bit. It's now $389 a day. Now, in my previous presentations, we used to kind of have a little calculator and add them up. I'll cut to the chase and tell you that, as you can see, if you put a calculator to these numbers, it can result in thousands and thousands of dollars. So it's very important that you keep an eye on these type of costs, because they can add up very quickly. Day 91 through 150, $778 a day. And anything after 150 days, you're on the hook for 100% of the cost. So it's extremely important and can be extremely expensive. So if you have not really considered long-term care, this is an area that you may want to consider, because as you can see, the cost can rise very rapidly. So that's your costs out of your pocket for Original Medicare Part A, which is the hospital. Let's look at Part B, your doctor costs in 2022. Well, let's skip down to nursing copays. This is an important slide, and I want to double back on it, because if you are in a rehabilitation facility, for example, We had a client here that had a mother that had some smaller strokes, and each time she was released from the hospital, she was put into a rehabilitation center. Well, the first days that you're in there, you have the first 20 days that cost you nothing. And so the son of this lady that started experiencing small strokes, he was always keeping an eye on the 20 days because he knew that there were no out-of-pocket costs for the first 20 days. But as you can see, if you need skilled nursing from day 21 to 100, it's now $194.50 a day. After 100 days, again, you're on the hook for 100%. So needless to say, as you can see there from those numbers, and if you put a calculator to it, it can result in thousands and thousands of dollars. So Medicare does not cover everything. If you look over to your Part B costs in 2022, this is your doctor insurance. Now your monthly premium has gone up a little bit. Your monthly premium is $170.10. Now what I want you to notice here is that you'll see the sliding scale up to $578.30, and that is based on your modified adjusted gross income. We'll talk a little bit more about that, but I want you to remember modified adjusted gross income. Your Part B deductible for 2022, your annual deductible for your Part B is $233 a year. And then after that, Medicare will pay 80% and you will pay 20%. So again, to kind of put a bow on this, original Medicare covers much of the cost, but it does not cover all of the costs. So let's take a look at your monthly Medicare premiums. As I mentioned, the MAGI, the gift of the MAGI, the modified adjusted gross income in 2020 was, as you can see from your earnings, if you made $91,000 or less and you filed as an individual, your Part B premium is going to be $170.10 for 2022. As you can see the numbers there as you file and you're married, you can see your income 182 or less. Now you'll notice that those numbers, as they go up on your income, you can see that your Part B premium can go all the way up to $578.30. So let me kind of elaborate a little bit why your premiums may go up for your Part B. With the current tax cuts that are in place, we are seeing an awful lot of clients that are choosing to, quote unquote, dequalify their qualified plans. Well, we know from the tax cuts of 2018 that we have a certain amount of time to dequalify our qualified accounts. We know that in December 31st of 2025, that the tax cuts will revert back to what they were in 2017. So Congress, all they have to do is nothing, and we know that there's a tax increase in 2026, January 1st of 2026. We could see tax rates going even higher. So what we're seeing is a lot of people right now that are visiting us are coming in to dequalify their qualified accounts, their 401ks, their 403bs, and the like. Well, if that's the case and it puts them into a higher tax bracket, for the time being, the 24% tax bracket really is kind of the sweet spot. Yes, your Medicare premium, your Part B premium could go up, but as soon as the taxes are paid off on those qualified accounts, then your Medicare premium will go back to 170.10 or what it will be. They're never the same. They'll go up a little bit each year. But for example, if you dequalified them and you stayed for your 5 years, it would go back down to, say, $170.10. So you have some options with original Medicare. Your option one would be the original Medicare, which is Part A, your hospital insurance, your Part B, which is your medical insurance, but then at this point you can either add a Medicare supplement plan or a Medigap plan and a prescription drug plan. Now let me give you some advice here. a lot of people come to us as they get ready to retire, and they're pretty healthy. And they will say to us, well, really, I don't need a prescription drug plan. I'm okay. I don't need one. And we always advise them that go ahead and sign up for a Part D or a drug plan as you start your Medicare coverage. Why is that? Well, if you down the road would need a drug plan and you didn't sign up for it originally, there are some penalties involved. They're not large penalties, but they are penalties, and they will stay with you throughout. So even though you're healthy, maybe you don't take any medications. We've had a number of clients come in and sign up for Medicare supplement, and they don't take any medications at all. But we always tell them take the cheapest plan out there, anywhere from $15 to $25 on your premium, but take it, because it will, in the long run, you'll come out ahead with your penalties, and you won't be experiencing those penalties. Your other option, if you look over to the right side there, you will see the Medicare Advantage plan, or what is known as Part C. It combines Part A and B, original Medicare, which is your hospital and your doctor, and in most cases, it will include your Part D or your drug plan, and in a lot of cases, it will cover things like vision and dental. You will hear that. So for a lot of people, that's awful attractive, and if you watch some of the commercials out there that are on television, a lot of times they'll say with a zero premium. Now, there are some things that you're going to want to consider with your lifestyle in retirement that may help you make that decision whether I should use original Medicare or if I should do a Medicare Advantage plan. We'll talk a little bit more about that. So a Medicare supplement plan. Let's just go ahead and start with a Medicare supplement plan with a Medicare plan. So you can add one or both of the following to original Medicare. Now, in a Medicare supplement insurance plan, it is offered by private insurance companies. All of these insurance companies out there have to offer the same coverage. So it's more premium driven with a Medicare supplement plan, and we'll look at the coverages here in a minute. But there, for example, United of Omaha cannot offer a different plan than, say, Aetna. They all have to offer the same coverage. It's part of the Seniors Care Act, and it helps pay some of the out-of-pocket costs that come with original Medicare. And again, we want to encourage you to go ahead and sign up for your Plan D. Think of D as drugs, and that helps pay for prescription drugs, even if you don't take prescription drugs at the outset, because, hey, 2 years into retirement, maybe you do see the doctor, and now you do have certain prescription drugs that you need. Again, you don't want to get caught with a more expensive plan and then have some penalties on top of that. I'm going to leave this slide up for a little bit for you guys to look, because a lot of times when we do our workshops with people, this can sometimes be a confusing graph here. What we like to do is we kind of like to point people in the direction of a Plan G. And if you look at the Plan G, it's right in the middle of the chart there. And you'll see the 100%, and off on the left-hand side, you'll see the benefits. Well, with a Medicare Supplement Plan G, you'll notice that all of the coverages, your Medicare Part A coinsurance, your Medicare Part B coinsurance and co-payments, Part A hospice care, all 100% coverage. The only thing that's not covered in a Plan G is your Part B deductible. And what did we say that was this year? A little bit more than $200. So what that will save you in a premium, if that saves you more than $200 a year in premium, we always say that the Plan G really is the way to go if you're going to go with a Medicare supplement plan. So let's take a look at some of the costs in 2022 for original Medicare. If we were to have a Plan G Medicare supplement plan, what would a Plan G cover? Well, if you'll remember, our Part A, our hospital premium, is zero because you've worked your 40 hours over your working career, but there's that deductible, $1,556. With a Plan G, that deductible is covered. Your room copays, you'll notice the strikes through the costs. Up to 60 days, nothing. 61 to 90, $389 a day. Day 91 through 150, $778 a day. Anything after 150 days, again, you are responsible for 100% of the cost. So again, a lot of people are visiting us about long-term care, and there's been some major changes in the long-term care world by which life insurance can be leveraged with long-term care. A lot of people have the belief that they're like the old standalone plans and that your premiums go up, and if you never use it, it's just premiums that have gone away without any use. Lots of changes. So if you're interested in that, we would strongly encourage you to go ahead and call our office and set up a time for a visit, because we have a lot of people now that are dequalifying their qualified accounts. If they have the health to go ahead and look at something called a LIRP, a life insurance retirement plan, you're able to leverage that into a life insurance policy by which that you can use that money against the death benefit for long-term care coverage while you're alive, tax-free, because you've dequalified your accounts. Should you pass away and never use the long-term care, and you want to pass along your death benefit to your heirs, you can do that as well, tax-free. Very, very powerful tool. You have to be able to qualify for it medically, but again, I would encourage you to schedule a time to visit our office, because it is something that not a lot of people are very aware of, but once they learn about it, it has become a very, very powerful tool in their retirement. So yeah, schedule a time to come visit us. We'd love to talk to you more about that. As you can see, the skilled nursing, again, we had this, I used the client that had the small strokes, and each time she went to the hospital and was released, she was sent to a rehabilitation center. And the first 20 days, again, you pay nothing. Day 21 to 100, that $194.50 is covered by a Medicare Plan G. And after 100 days, again, you are responsible for 100% of the cost. Take a look at Part B. Your cost in 2022, on average, most everyone will pay right around $170.10 out of their Social Security check. So it will automatically come out of your check, $170.10. But again, we talked about the modified adjusted gross income, where if your income surpasses certain levels, yes, your Medicare premiums can go up as high as $578.30. That Part B deductible, $233 a year. If we were to have a Plan G, you would be responsible for that $233 annual Part B deductible. But here's an important one. Look down at your copay. With a Plan G, the 20%, the 80-20 copay, the 20% is covered by Plan G. So the advantage of a supplement plan in retirement, and this is what we tell people, is that you have a known cost. And in retirement, when you're starting to budget for retirement, if you know what your out-of-pocket costs are going to be every year, it's much, much better. Now, a lot of people about this time go, well, I think I want the Medicare Advantage because I don't pay a premium. You know, my Part D is included. I get vision, dental. There's a lot of advantages, but there's a couple of things that you want to consider when considering a Medicare Advantage program. Sometimes your doctors are not in network, so you want to make sure that if you do a Medicare Advantage plan, and we can help you with Medicare Advantage, but these are some considerations that you'll want to consider. For example, I'll give you a great example. We had a client that was up in Laughlin. He lived in Sun City. He took the bus trip up to Laughlin to have a weekend at the casinos and ended up having a heart attack. He was on a Medicare Advantage plan, but he had to be air evac'd back down to Phoenix, to an emergency center down here. Well, the Medicare Advantage, he was out of his zone, his Medicare Advantage zone, number one, and number two, it didn't cover Air-Evac costs. So the gentleman, while he was paying zero premiums, and up front it looked very attractive to him, on the back end, he had to pay thousands and thousands of dollars for that Air-Evac trip back to Phoenix. So again, as you're beginning retirement, the three stages of retirement, the go-go years, the slow-go years, and the no-go years, these are very, very important things to consider, because if you're just starting out in retirement and you got a lot of energy and you're going to travel back to the Midwest and see your grandkids, we had some clients that had some family in Hawaii. If you're going to be traveling and on the go all the time, you're going to want to seriously consider a supplement plan versus a Medicare Advantage plan. As we mentioned, Part D is drug coverage. You usually choose Part D in one of two ways: a standalone plan along with a supplement plan. And like I say, if you're healthy and you don't take any prescriptions, we always kind of say sign up, don't take the penalty, and go ahead and take the cheapest one. You can always go back and change it down the road if you visit the doctor and he puts you on prescriptions and you need a little better plan. Well, you certainly can go that way. As you can see, as part of the Medicare Advantage plan, that also includes Part D, but if you enroll in a Medicare Advantage plan with prescription drug coverage, you don't need a standalone plan. So if you go the Medicare Advantage route, you don't need to sign up for a separate plan. Take a look at some of the costs of your prescription drug coverage here. Your Part D deductible is anywhere from $0 to $480 depending on the plan. If you sign up for a Part D, depending on the cost, obviously you've probably dealt with health insurance over your lifetime. You know that, if your premium is less, then your deductible usually is a little bit higher. From $480 to $4,430, you're responsible for a copayment depending on your tier. Now, this is called the donut plan, the coverage gap. So from $4,430 up to $7,050, you are in what is called the donut hole. So you will pay 25% on a generic name prescription, and the plan will pay up to 75%. You will receive a 70% discount on brand name drugs, or you will pay 25% on brand name drugs, or 5%. So anything over $7,050 is called catastrophic coverage, and you'll pay the greater of 5% of the cost, $3.95 for generic drugs, or $9.85 for brand name drugs. So, Medicare Advantage, we just talked about it. Plan C. This is your option too. You can choose a Medicare Advantage plan, and there's nothing wrong with that. But again, you're going to want to consider your lifestyle. Am I going to be traveling? Am I going to be doing things outside of my HMO or my PPO, outside of my network of coverage where I could be affected? As you can see, Part C, it combines Part A and Part B, your hospital, and your Part B, your doctor. Also includes Part D, and many times, as you see on TV a lot of times, it'll offer additional benefits such as vision and hearing, those type of things. Some very important dates to remember, and this is a screen that I want to talk about a little bit more. One of the things that we stress to people as they come to visit us here at our office as they get ready to retire is once you pick a plan, your very first time out of the gate is what they call guaranteed issue, meaning that no matter what health issues you may have, you will be issued a plan, whether it be a Medicare supplement plan or whether it be a Medicare Advantage plan. It's very, very important that you pick the right plan because it's a guaranteed issue. Now, that's not to say that a year into it, if you don't like the plan or you want to go ahead and shop the plan, maybe try to save some premium, you can do that. However, you will most likely go through underwriting. And underwriting when it comes to seniors is a little bit different than, say, a life insurance underwriting situation. However, if you're declined at that point, you're kind of stuck with the plan that you started out with. So again, I can't stress this enough. You want to make sure that you get out of the gate in retirement cleanly, and you understand the difference between Medicare Supplement and Medicare Advantage. So let's take a look at some of the important dates out there. This is called your annual election period, or your AEP, and it runs from October 15th through December 7th. And I'm going to kind of slow down here and kind of let you guys read along with me here. This is when you can switch from original Medicare to Medicare Advantage or vice versa. Now, again, once you're out of the gates, your first time out, it's a guaranteed issue. So if you decide, say, a year from the point of which you made your choice and you want to go back, switch back, now you're going to probably have to go through underwriting. And if you're healthy and you don't have anything to worry about, shop all day long. But again, you want to make sure you get out of the gate correctly. You can switch from one Medicare Advantage plan to another Medicare Advantage plan. You will have to undergo underwriting, though, or you can enroll in a Part D prescription drug plan for the first time. As you can see in parentheses there, a late enrollment penalty may apply. So you want to make sure you sign up for your Part B with Social Security as you get ready to retire, and you also want to sign up for a Part D plan because, again, those little penalties, while they're not a lot, they kind of nag at you as you go through retirement. So it's just one less thing to worry about in retirement because you want to enjoy your retirement. You can switch from one Part D to another, and then you'll see that the open enrollment period is January 1st to March 31st. So right now, we are in the open enrollment period, and as this webinar ages past March 31st, these are dates that you're going to want to remember. So you can switch to original Medicare, Medicare A and B, and standalone drug plan Part D. So in other words, if you're at Medicare Advantage and you want to go back to original Medicare, you can do so, or you can switch to a different Medicare Advantage plan, but you can only change once during this period. So again, take a look at your differences in coverage. Option 1, Medicare Supplement. It comes with a monthly premium. So you've got your $170.10, which will come out of your Social Security check, and then you'll have a premium for your supplement plan, and then a small cost for your Part D. But the advantage of that is you'll have a known fixed cost to budget into your budget as you start retirement. It's federally regulated. As I mentioned, all those coverages that we looked at in the full screen, they all have to be the same coverage. So United of Omaha cannot offer a different coverage than Aetna. So primarily it's premium driven, and you want to make sure there's some questions that you'll want to ask us about when you come to visit. Sometimes we can look at the different companies and we can look at their rate increases, how fast they've increased over the year. A lot of times they'll stay. Some of the better known companies, you won't see quite as drastic of increases in their premiums. Plans remain the same for each of the carriers. So in other words, again, one company cannot offer better coverage than the other. They all have to be the same. And that was that graphic that we talked about before, guaranteed renewable. So once you have your plan, it's guaranteed renewable. They can't drop you. But again, if you wanted to go from another company to another company, you would be subject to underwriting. Underwriting required except for your IEP or your initial enrollment period. Medicare Advantage coverage, usually $0 premium for a month. And, you know, again, that tends to get people's attention right out of the gate. Wow, zero premium. But again, as we mentioned in the example we used with the Aerovac, there are some costs that could be incurred on the backside that result in thousands of dollars that all of a sudden now on the Medicare supplement side, you're going to come out ahead with a known premium. State and county based. So in other words, if you travel, again, we had these clients that had family in Hawaii, And so, once that client knew that if I was injured in Hawaii, now I'm out of my state, I'm out of my county, now I'm going to be faced with some big costs if I chose the Medicare Advantage. They do now offer network plans, which are HMO and PPO. This is usually approved annually by the CMS. There is no underwriting. It is covered. But if you go to switch back, then there will be underwriting involved. So here's some questions to ask yourself to help you determine what plans are best for you. Now, do you want to be restricted to a network of doctors, specialists, and hospitals? Or do you want to have that PPO plan where if you travel and the doctor takes Medicare or the hospital takes Medicare, why your Medicare supplement would cover that? Do I want to pay a monthly premium? Again, that's a two-sided coin that you'll want to ask yourself. And again, we encourage you to schedule a time to visit our office and we can go over some of those questions that you may have. The ability to travel and use any doctor and hospital who accepts Medicare. We keep going back to this, but this is important. And if you have grandchildren that are clear across the country and you plan on seeing them, you're going to want to consider seriously a Medicare supplement plan. My yearly out-of-pocket cost could be up to $6,700 or more. That's your Medicare Advantage. You could be facing higher costs. If you don't want to worry about your doctor going to be in network or out of network year to year, or be surprised by unexpected healthcare costs. So if you answered no to at least 3 of those questions, you may want to consider a Medicare supplement plan. So we can walk you through all the plans in our area and your area. Again, I encourage you to give us a call, 602-456-1928, or you can visit our website, www.winstonandcompanies.com. We'd be happy to schedule a 15-minute consultation on the phone. We can schedule a time for you to come here to the office. And again, we are brokers, so we are not beholden to any one insurance company. We have the ability to work for you and find you the best coverage out there. So with that, I'd like to thank you for joining us today. Again, I encourage you to set up a time if you're getting ready to retire. My name is John Roller. Again, our phone number is 602-456-1928. Our website again is www.winstonandcompanies.com. And remember, if you don't know where to begin, better ask when.